Good afternoon. It is March 10th. Welcome back. Hope everyone had a good break. Got some time to recharge, rest, relax. We are starting in today with H814. We have a new version that I don't believe we've seen the new language, correct?
We haven't done a walkthrough yet.
Not done a walkthrough. So let's do a walkthrough of new language. And then we also have the Attorney General's office with us a little bit later, but they're not able to get here right now. So we might be taking a break through this. And we're going to have some committee discussion also. Hi, Jen.
Hello, good afternoon. Jen Carby from the Office of Legislative Counsel. We are going to look at draft 1.1. This is a strike all amendment. I'm going to put it up on the screen. It's also on your committee page. So this is H814, an act relating to neurological rights and the use of artificial intelligence technology in health and human services. And as I said, it's a strike all amendment. It's showing in markup. So you can see the changes. So there are no changes in this draft to the intent section. But then section 2, which was enacting a new section, a new chapter in Title 18 on neurological rights. Most of this gets struck through. So there's some change made to this purpose and the individual rights, but the rest of it is all struck. So you could potentially enact legislation in this chapter, expanding on this at another time. So this would have still the state recognizing each individual has the right to, and it keeps mental and neural data privacy and freedom of thought. It changes cognitive liberty to non-discrimination in the development and application of neurotechnologies. And then it continues with the bill as introduced to the right to change an individual's decision regarding neurotechnology and the right to determine by what means to change that decision, and the right to be afforded protection from neurological interventions of the mind and from unauthorized access to or manipulation of an individual's brain activity, and to be afforded protection from unauthorized neurotechnological alterations in mental functions critical to personality. And everything after that would be struck. So I'm going to scroll through this fairly quickly. If you want to look away, it takes us to page 23. It's all struck. Oh, next clean version or next version you do for markup will be considerably shorter. All right, when we get to page 24, and we still have what is now section 3 is the Artificial Intelligence Advisory Council, and you'll see that some of the things that were struck in those intervening pages come in as part of the charge to this council to do some investigation and report back. So it keeps the changes to the membership of the Artificial Intelligence Advisory Council, including changing an appointee from being appointed by the governor to the National Association of Social Workers Vermont chapter, changing the appointee from the Commissioner of Health or designee to one member with experience in public education appointed by Vermont NEA. Keeps the new member with experience in healthcare appointed by the Vermont Medical Society. Keeps the addition of the Secretary of Human Services or designee, and it keeps the addition of the State Treasurer or designee. And it keeps the extension of the sunset on this advisory council. But it currently expires June 30th, 2027. This would extend that until June 30th, 2030. And then in what would now be section 4, this report on responsible and ethical use of artificial intelligence in healthcare, human services, and education. The changes here, and again, the lead-in language is the AI Advisory Council in coordination with the Director of the Division of AI, that's in the Agency of Digital Services, and they're still reviewing guidelines and recommendations, still researching existing and potential uses of AI in public participation processes and in public finance, and creating opportunities for public education engagement and development of AI policy and reporting back. But in addition to recommending any additional statutory changes needed to further the purposes of this act, it specifies that those could include protections for neurological rights and in relation to neurotechnology, so protections in relation to neurotechnologies, guidance on the use of generative artificial intelligence by regulated professions, and regulating the use of artificial and augmented intelligence in health insurance utilization review processes. And then it continues on with the rest of the report as in the bill is introduced. And finally, the effective date section would, just the section number would change, but the effective date would still be July 1st, 2026.
Wasn't there a sunset? Was there a sunset on something?
Yeah, it delays it.
It's still, right, it still
It's still
extends
dated.
that sunset on the AI.
Oh, okay. I'm sorry, I missed
The
that.
council, yep.
And
And
it
then
still
one of the
asks
things,
us.
yeah, one of the things that gets reported on is, are there reasons to further delay or just remove the sunset?
So you give them extra time and then give them time to wait so that they can weigh in on if they need time.
Right, they want more time.
Okay, and we've replaced members of the Artificial Intelligence Advisory Council with
Right, and these were in the bill as introduced, but these are having some of the appointing authorities and change around the areas of ethics and human rights. And adding someone with experience in public education, someone with experience in healthcare, as well as the Secretary of Human Services and State Treasurer or their designees.
let's go Leslie and then.
If I recall, there was discussion about having a nursing representative on here because the nursing interface, at the bedside, using artificial intelligence, I think it's gonna be a thing. So just wanting to know where that landed.
So I have a list of all the people who have requested. What I would like to do is, when you're ready for us to do this, like, to look at that, that's the section of the bill I think that we need to work on, because there's been a lot of requests, and I would like to read them all to you, like, be like, here's the list. I think we need to decide, what are we gonna do? Because if we give everyone a seat, we're like doubling the size of this council. I do have a compromise idea to put out there between doing nothing and adding everyone that I would like to share. But I would think first everyone needs to hear the whole list of who's asked. if
All
that's
right.
okay.
The other thing that I want to mention is that remember, unless you're representing like part of the administration, so in other words.
Per diem, so you're talking about per
Yeah, I'm
diem?
talking about per diem.
Yes.
So
I'm actually just
would
pulling
not.
up right, so just pulling up the full language to see if, if it is, if it addresses per diems, but typically, yes, so members of the advisory council who are not employees of the state and who are not otherwise compensated or reimbursed for their attendance are entitled to compensation and reimbursement of expenses as provided in 32 VSA 1010. So basically, if somebody is there because their work sent them there and they're getting compensated for their time, they're not entitled to compensation and reimbursement of expenses. But if they are serving in their personal capacity, they are.
Yeah,
So
so
clarification too, when you.
go ahead. And I just want to, when we talk about adding members, I want people.
It's potentially a cost depending on who those, like adding Secretary of Human Services or designee. So long as the designee is also a state employee, there shouldn't be a cost.
But adding, say, one member with experience in healthcare appointed by Vermont Medical Society.
Right, might be
There.
serving in their personal capacity and not through their.
And so,
We need to be conscious
Yeah.
of that.
exactly.
Go ahead, Brian.
Yeah, so I'm gonna read you the list, and then what I'll say is that,
I want to hear the list for sure, but there's an A through D, I think, on members, and could we just get reminded who that might?
you wanna see what that is.
You want to see the whole?
Yeah, just because, see how it all melts.
I think that's reasonable to ask, yeah.
Good thing. I have-
And we can change those too. when I wrote the bill, didn't think we should.
See what's behind the ellipses.
Yeah, what is there?
What's behind the ellipses? It's like the radio show.
So the under current law, the advisory council is the Secretary of Digital Services or designee, Secretary of Commerce and Community Development or designee, Commissioner of Public Safety or designee, Executive Director of the ACLU of Vermont or designee, One member who is an expert in constitutional and legal rights appointed by the Chief Justice of the Supreme Court. One member with experience in the field of ethics and human rights appointed by the governor. So that's one that would change in the bill. The appointing authority changes to the National Association of Social Workers Vermont chapter. One member who is an academic at a post-secondary institute appointed by the Vermont Academy of Science and Engineering. The Commissioner of Health or designee, and I think that one is one that changes to become the person with experience in healthcare appointed by the Medical Society. Executive Director of Racial Equity or designee, and the Attorney General or designee. And then there's a couple of new ones added.
Actually, the Commissioner of Health or designee got replaced with somebody from the NEA.
No, oh, yes, but,
Yeah, sorry.
but then I added the Agency of Human Services.
Sorry, I was going by
Yeah.
memory with
So it
the.
didn't really get replaced, it was more like shuffled, re-represented. And if I may share this, when I was looking at changing the membership up, I realized that if you look at who's on this, the majority are people who are appointed by the governor. Even though it says Secretary of Digital Services designee, the governor appoints the secretary, the governor appoints. So like the administration, the executive branch had most of the power on the council, not the community, not the legislature, not that we should, but I'm just saying like, so I felt like we should give more, not only did I feel this, but we heard on the record that they needed more public representation. Like we heard testimony that would be useful. So I was like, how do we add in healthcare providers and shuffle the membership up? And I tried to not eliminate seats really. So what it does is basically the administration loses one seat because and in the way I proposed it, and and then we added some seats. And so, but I do think we need to hear all the requests and take those into account because I don't think it's only fair to hear them and consider them like.
I just wanted to look at technical, yeah, because okay, so currently I in statute is the executive director of racial equity, and yet in this bill, I has new language.
But I itself is not underlined in the bill because I is existing, so it put in an I, people move down. I was just putting some of the new numbers together.
It's just a format.
You're designating, yeah.
Okay, got it.
Executive Director of Racial Equity becomes K.
Okay, all right. I thought we had accidentally like dropped
For
somebody
no
off.
particular, no specific reason.
Thank you. I didn't mean to interrupt you. I was just like, I'm like, wait. I thought.
It's
we
good that everyone
lost the-
understands exactly what's happening.
Yeah, and if it's helpful, so you can also see an existing law, and this does not change in the bill, it's just not in here. It says members shall be drawn from diverse backgrounds and to the extent possible have experience with artificial intelligence. So that sort of those parameters kind of, apply to the whole list. And then it talks about meetings and at this point, not more than monthly. They get support from the Agency of Digital Services. It also directs them to consult with any relevant national bodies on artificial intelligence, including the National Artificial Intelligence Advisory Committee, established by the Department of Commerce and its applicability to Vermont.
Brian, I sort of interrupted you.
Okay.
Did you want to finish before or had you finished?
Well, I think
Before I go to Leslie.
what I was trying to articulate was that I was trying to figure out how to add some healthcare providers and an educator to the task force without messing with it too much. And the original, the council, the original AI task force had a member who was a social worker with human rights and ethics. And since the governor already is responsible for so many other seats, I replaced the governors with the NASW. I added in a healthcare provider from the doctors and a teacher, and then replaced the commissioner of health with the Secretary of Human Services, because the Secretary of Human Services could appoint the Commissioner of Health. They're in the same chain of command, and ultimately those are all those agencies are people who are under the governor. So the governor still has authority over most of these seats, like all those seats. So it wasn't really taking from the governor. That wasn't the intent, even though it looks like I felt bad. I'm striking the governor out, but it just didn't make sense to me to have the governor appointing that when that could be a place a healthcare provider could be in. when it's time to hear all the suggestions from people, I do think some of the testimony we heard has made me reconsider my original proposal. And I do think we should take a moment and think about, do we adjust it a little or not? But like, I want to at least make sure we hear the list of requests and consider it and not just ignore.
Sure.
Because even on the record, like we heard, the Agency of Digital Services said, I'll just use this as an example, the individual who's been appointed by the governor is a cybersecurity professor at Norwich University or something, and brings a lot to them around the industrial military kind of perspective. And it would be a loss to not have that person on the council. But I don't necessarily think that should be the seat for ethics and human rights. Like, he could be appointed by the governor for another seat. So I want to talk about, like, how do we do this in a way that we don't force people off the council who are an asset? But you know what I mean? Like, I don't want to like make it be that this good person gets kicked off because of our decision. Although the governor could have someone else appoint him to another way, or we can give the governor like a member at large or something. So I would like us to talk about that for a minute.
Yeah, I was gonna say, is there anywhere in existing statute that, you know, I mean, oftentimes we make these things and it's like, anyone else you want to put on it? Is there anything in existing statute that allows people to be appointed that maybe don't represent this, but have an expertise that could be appointed if not?
No, I mean, I'm not sure.
I don't know. I mean, it just feels like every time we create some sort of group, there's usually a little thing at the bottom that says, or anyone else.
I see what you're getting at.
I mean, sometimes you will require a group to consult with interested stakeholders, but you typically don't give them a seat on it, especially because of the per diem.
Yeah.
Yeah.
And it's also just difficult to determine when there's a quorum if you don't know how many
Yeah.
people are on the.
Okay, Leslie?
I just need help with understanding, and I really appreciate this. But this bill, right, is about the use of AI in health and human services. But a lot of those people that are listed, I'm not sure of their intersection with health and human services, and that's where I'm a little stuck.
They are
I'm
the
not saying we
existing
should have
council.
two.
They're the existing council.
No, but they could still be on it. I mean, A through F or whatever
So
is
we're
still
not-
on it.
So we're
Yeah.
not creating this. We're taking an existing council,
Got it.
which frankly, when was this council?
22.
22?
Yeah.
The fact that AI is so prevalent in healthcare, I am shocked. There are not representatives of the, you know, the entire.
I mean, it may have to do with what the
Care.
agenda is that day. I mean,
Yes.
I'm just trying to understand how a group so diverse, when this is specific about health and human services, AI and technology in health and human services, has these people that really don't have any intersection with that arena.
They do though, if they kind of do
It's
that.
only techie,
Huh?
because it's tech.
Well, think of it this way, the Department of Public Safety intersects with the healthcare system. The Department of Commerce intersects with the healthcare system.
Like, that's what I want to understand. How does, like, how would it work in this case? Just give me an example, just like.
Okay, so for example, let's say we're looking at protection for neurotechnologies. It might be important to have public safety weighing in if there's public safety uses of technology that intersect with the healthcare system. And commerce, like, health technology stuff, technical stuff does end up in the Commerce Committee. Like, AI bills have ended up there. Data protection ends up there because it's commerce. It has to do with trading things. So the healthcare sector and commerce intersect all the time, and we've had bills go between us. So I think the idea here is that this group isn't equipped with the people it needs to weigh in on policy at this time with healthcare. So we would be adding members. An alternative, which we could go down this rabbit hole, would be to create a working group that works with them or something. But what I was going to, instead of complicating it, is adjusting the membership slightly to what's proposed. Like, look at the request and adjust it slightly, but then put language in similar to what Jen said about must or shall consult with interested stakeholders. And we could always say including, and list some people, because then all these organizations who are offering to send staff, because I want you to hear like the requests, all these organizations are saying, we'll have our staff go and they don't have to get a per diem,
Okay.
you know, so.
Let's table for right now the discussion around maybe changing up members and we'll look at like some input that we've received. But Daisy has a question.
About changing up members.
Okay.
I guess it's more of a comment than a question, but I haven't sat in on one of these AI task force meetings. I feel uncomfortable prescribing new members without having heard more directly from them as to what they need or what they feel they need in order to fill a gap in expertise around healthcare.
We did though.
We heard from the director, but I mean,
We heard from
can I
the,
just finish?
oh, I'm sorry.
I feel like I want to stay in our own lane with regard to adding expertise on healthcare and then keep it equitable for all the other sectors that are represented there too. I feel like we're thinking too harder on this than we should. The expertise and the request should come from the committee as to what they need.
Is there a chair? Is there a chair of this advisory?
I mean, the director
Council.
came in and they said they came in and testified on the record
Okay.
to supporting this.
Can you remind me?
It was Josiah Raish and it was Miles Lantham. And it was, I don't believe you were here that day.
I was not.
Yeah. But they were here, they testified. Do people remember for like an hour, Josiah and Miles, and they were talking about the membership and they were supportive. But they're the ones who said they don't want to lose the governor's appointee. That's their only concern that they brought up. So they were kind of saying like, we think there needs to be a social worker. We think there needs to be a doctor and a teacher. There needs to be more expertise from those things, but it would be sad for him to go.
Great,
Because-
let's go with what they recommend. Like
Yeah.
if that's the committee that does the work, they know the work and they know the capacity and the gap best, but like I don't think any of us has sat in on a functioning meeting of that and have the ability to really add to their workload by adding more members.
So I apologize because I was not here that day. What did they recommend? What was their recommendation?
They supported what was before them and their suggestion was that they said they didn't, it wasn't so much a suggestion as much the concern was losing the governor's appointee. Not having a social worker, they want that, but it was like losing him. And that's why my suggestion was gonna be, we give the governor a seat, like that'd be like the governor gets a member at large. That they can pick anyone that they think is good to put on this, but we let the social workers still have their seat, the doctor still have the seat, and the teacher still have a seat. So it'd be a way of accommodating their concern.
Daisy, did you have a?
I just think that we should ask them for a list of what they think the committee should look like. Ask them for the language, because I think this is I'm getting confused.
We can ask them to come in again and weigh in on it again.
My suggestion is just
Did that.
They did
the
do it already.
language, send the language of who they need.
Well, they said they were okay with what was before them at the time.
This
This
language,
experience should be defined, because expertise is, just my opinion, it sounds a little more solid than experience. Experience could be 2 weeks.
I couldn't hear you.
Experience, one of the qualifications is that you have experience.
Oh,
with
yeah.
AI.
Yeah.
And I don't think that's solid. Expertise maybe, be a little better than normal time.
what does existing statute say?
Existing statute is experience. So
Experience.
members shall be drawn from diverse backgrounds and to the extent possible have experience with artificial intelligence.
So we're not
We're just using the same
changing- we're
language.
using-
Nothing in the bill.
Nothing in the bill changes that.
All the bill really does with the membership is it adds someone from the social workers, adds someone from the doctors, and adds someone from the teachers, which is what they felt they needed those areas. Oh, it also adds the treasurer. And we heard they were okay with that, and the treasurer supports that, and that's because they're gonna be looking at public finance and how that relates to healthcare is like, they may be able to figure out ways to improve the financing of our healthcare system. And the treasurer should be part of that and agreed. It was brief, but they came in and said yes.
I disagree with that.
Disagree with what?
I think the treasurer could play a part, but this is kind of setting policies. And he is financial as far as money for the state. But I don't know. I just don't understand why he's even on there. And a couple others I don't understand. I agree with Leslie. I think there's a lot of others that are in with us with healthcare that we should do first. So,
Well,
you
no,
are-
I mean, I'm not saying we should change it.
no, I just know,
I was just trying to understand.
I don't want 30 on there either.
I just want to, I know, I was gonna say, you're usually the one saying, do any. So what you're saying is that you do not agree with M, the state treasurer designee. So
Well, if you can explain it
My understanding.
better than Brian did, I could probably understand it, but you're talking about,
If I can explain it for you better, I can. I'm willing to, I just don't want to like give people a speech, but I can explain it better. That the state treasurer is responsible for managing the treasury of the state.
right,
And that this group is going to be looking at public public money and how public money is managed in the healthcare system and beyond. For example, in Slovakia, they're using AI to help create the government's budget now. And so the treasurer being on here he's one member, or whoever he designates. He might designate someone else. That's one. Yes, they, because who knows who the treasurer is going to be, right? That they would have a seat, because that seat would bring the perspective from state government of managing the public's money. And I think that's relevant to healthcare and beyond.
in my thinking, you're right. But the policy people will go to the treasurer and get him involved, not being involved in it. That's kind of even a conflict of interest. You know,
I think it might be useful to look at the lead-in language of the existing statute, which is not getting changed here, about what the role of the council is. The council has been established and is in existence to provide advice and counsel to the director of the Division of Artificial Intelligence in the Agency of Digital Services with regard to the division's responsibilities to review all aspects of artificial intelligence systems developed, employed, or procured in state government. It also is directed to engage in public outreach and education on artificial intelligence. So I don't know if that helps you
About state government, yeah.
think about who, about who.
Do you see how that
you want on it.
means why the treasurer would be included then? Because the treasurer is managing the state government's money, and if they're not included and weighing in, we're leaving a piece out.
so how come we don't have a legislature or senator?
But that's a good point. I see it as we're delegating our spots to these healthcare providers. That's how I saw it. I was like, instead of us appointing ourselves, we're creating space for community members, the people we represent who have expertise, so that we're balancing that out with the judicial appointment, with the executive appointments, with the attorney general, and with the treasurer.
Brian, can I ask why? If I were on this council, I would expect the conversation to stay at sort of a consistent level. My concern is if we start adding healthcare providers from different areas of healthcare, it's not going to be equitable with, like, the treasurer, for example. Like, he has different branches in his office, as does like the AG or whoever else is on here. So I worry that we're getting too nuanced in healthcare rather than just leaving the commissioner of the Department of Health or the secretary.
So there's 18 members on this,
Yeah.
and we've now put 3 that have a focus in healthcare.
That's
I
all
think
matter.
I'm not sure there's 18 people.
Well, I'm just going to M. A through M, isn't,
It's not.
or maybe, did I count wrong?
11,
13, 15, 18,
I think I'm only like 8.
13, okay, 13. Did you?
It would be to M.
I mean, the reason we'd be adding an educator and a social worker and an MD or a doctor is because, well, that's who the current language doesn't say a nurse, it says the AMS. The nurses are asking to be, I have a list we haven't even heard yet of all the people asking to be on this, and I think we need to hear that list, just to at least hear it. Adding 3 healthcare providers from the community, the idea was that was bringing on the ground expertise into the discussion as they weigh in on these important issues at this moment in history. And that was something asked for. So.
I mean, I'm just going through the original intent of this bill.
Yeah.
And the original intent was to protect human rights, healthcare in regards to artificial intelligence, as well as I still don't have the essentially neurotechnologies. And again, I'm a little concerned that there's not someone on this advisory committee right now that's thinking in these terms, but go ahead. Topper, you had a question?
Yeah. You talked about 13 members.
Yeah,
I'm looking at the bill and I see 8.
well, those are
Is
the
there
only
something-
ones that are in the bill.
Yeah, because A through E are not showing, so they're not changed.
Oh. Okay.
And we're only changing 3 of them.
We're changing 5, I mean, you're changing 2 existing ones and adding 3 new.
So we have someone with experience in education. Just keep thinking about that doctor from UVM that came in.
The ethicist?
Well, the one that came in and did the
Tech guy.
the office visit
Yeah,
on
yeah, yeah.
Leslie. And I just keep thinking that, like, there's nobody with that sort of experience here.
Yeah, but if we get a bunch of medical specialists, like, then the conversation amongst this board changes. And I am concerned about that. Like, how are they gonna stay productive and functional if you have a bunch of commissioners and then a bunch of medical specialists? Like, imagine a social worker trying to have a conversation with our state treasurer.
Depends on what's on the agenda.
They should be consulting or advising the secretary or the commissioner, in my opinion, like there's a representative from each sector.
I think the concern though is that the makeup of the council is all, it's them or their designee, so they could pick anyone. Right, but the idea is that these seats are controlled by the executive branch and that it was not a diverse enough perspective. And
Yeah.
the Director of AI, they were asking for a few more people. It's only a few more. Can I just read the list and get it over with of all the people requesting it? 'Cause it's torturing me and once I say it, then I don't have to say it again. I just feel like it's
So Brian, we've received an awful lot of written feedback on it.
Yeah.
So Brian
Forward it
has
to Tom.
compiled like various, he's going to summarize.
Yes. So these are people who have expressed interest in serving on the council. I'm not suggesting, I'm talking softly because I get excited, so I'm not suggesting that I am not suggesting we add all these. I'm just reading you the request. It's like I'm the DJ, this is what all the people wrote on the thing. I'm not gonna play all the songs. I'm just telling you what's on the thing. I may not like all these songs.
Before you get going, all of these people versed in AI.
I don't know, these are just, when you hear who it is. So-
These under your name on our website.
Yes.
Okay, so I sent her the evidence of them requesting. So we
Basically,
have,
public comment.
Yeah.
we received.
so I have received requests to be involved from the Long-Term Care Organization, Vermont Healthcare Association, from Bi-State, from Vermont Care Partners, from the Vermont Nurse Practitioners, from VOS, from AFT, from the Vermont Psychological Association, from the, okay, so it's not as long as I thought. So you could hear though, that all of these groups who come in here regularly are interested in being involved. I don't think we should add them all, but I think maybe there's a way to put language in so they're included.
Social workers, you didn't list them.
Well, they're already on it.
Did they request to be on it?
Yeah, well, they requested a language change too. They requested that it instead of saying one member with experience, it says a social worker with experience. That was their requested language change. So they want to be on the council and they actually want them to be told it has to be a social worker because they think it's that important that it's not just that the social workers are picking a random member, but that the social workers are sending a social worker. That was their suggested change. So anyway, that's my list. Thank you for hearing.
That's great. It's all in one, and thank you. It's all in one document that Tasha put in.
Thank you, Tasha.
It is.
That's I forwarded it all.
Fantastic.
Would anyone be amenable to adding language in because we have in here what they're supposed to be reporting back on or advising on? Would anybody feel like, that we should have them consult with interested stakeholders from,
I think it should
and
say
just put
like that.
something like that in language. Is there anything in that right now?
I think it said they shall consult with any interested stakeholders, and we could consider, this might be complicating too much, including and list some of these groups so that they are being told they have to talk with them, so the groups don't feel excluded. That's a way to include them without giving them a seat on the council and having to worry. Although some of these groups have said they would send someone who's paid and we wouldn't have to pay. You know what I mean? Like Bi-State, for example, said that they would send someone who's already being paid, so that we wouldn't have to worry about the stipend.
I'm sorry, are you looking at adding consulting with interested stakeholders to the council generally, or to its development, to its exploration of the responsible and ethical use of AI in healthcare, human services, and education?
That's what I was referring to.
So
I want to be equitable here, and I wasn't paying attention. Who had their hand up first?
Oh, I'm happy to.
I was like, okay, Daisy, go ahead.
there are 8 different healthcare provider organizations or associations that requested to be on that commission. Did you consider having a healthcare and AI commission and then giving them a designee on the overall AI task force?
I'm open to ideas like that. I just got these requests over the last week because we heard testimony, and then
Yeah.
I got all these emails from people saying, consider us. We're willing to help. And mostly they went to me or me and Alyssa. They didn't send it to the whole committee. So that's why everyone didn't see this. Now you know. Yeah. And I was thinking one option is we could create a working group or a subcommittee that works with them. But I still think we should add some people to the council in the long term. But maybe it's that, but at the same time, does it have to be that complicated? I guess that's the concern I have.
Yeah, I
I'm
want to
open
be
to whatever you
equitable
want.
about those requests.
Yeah.
That's a concern.
Yes.
A concern of mine as well. Leslie and then Val.
I'm not seeing a whole lot of difference between all these different groups about the constituency and necessarily their voice. I mean, is Bi-State going to be all different than the nurse practitioner? I don't see that. So I'm thinking I don't want to complicate it and make it harder. So I kind of like having the idea of because I'm struggling with this. This is about healthcare, but there are a lot of people on this group that don't know about healthcare. But I hear what you're saying, that there's a lot of cross pollination, but I still think it has a lot to do with what happens to be on the agenda, which is going to change, each meeting, and some will be relevant to a certain group and some won't. So without being complicated, should there be a subgroup of healthcare providers so that people feel they have their voice and can, respond when there's an agenda item that's in healthcare on the AI group, and then because it is just state government, and we have to remember that it's only state government that this bill's referring to.
Val.
I was just wondering if they could, not have reporting requirements from people that want to be heard that are not on the committee. Would that be a possibility, to just report pros and cons or something like that? So they are heard, but they're not. Then it could be a more diverse.
You couldn't require them to, you could invite them to, but you couldn't, because
Right.
they're not state entities, you can't require them to.
Right. Invite them.
I'm in favor of having a healthcare focus
Because
breakdown.
this bill is about, it's about healthcare.
Jen, I have a question for Jen.
Go ahead.
That within the existing statute or structure of law, do you see a way that we could make changes to the council like we are doing, but have a working group work with them for the next year of stakeholders, that's official versus just saying to them, you should just do this, maybe you see what I'm saying? Like, maybe we create a working group to, like, we make the council changes, but then we create like a 1-year working group or something. Because we do that all the time with other things.
I just want to point out again that any group that we create, any working group, any task force is going to require stipends.
We can make it free. The original task force, we didn't get stipends to be on it, because I was on it. We did it, we volunteered.
You did do that with some of the Act 68
Yes, I
meetings last
So the
year.
working group could be unpaid. And by the state, by the state could still pay a person to go to it. Not to look at you, but.
There you are.
I am not particularly in favor of creating a working group.
I'm not attached.
I think we're taking a advisory panel that was created a few years ago. And we are adding some members to it that are, how do I want to say, that have an interest in where emerging technology is going, and as evidenced by the number of bills on our wall around healthcare and AI that we've dealt with. It seems like perhaps this advisory council, advisory council should include people with some sort of knowledge or interest or thinking about it in those terms. Topper, did you have a question? I thought I saw your hand up. I'm sorry, I wasn't sure.
I probably did, but I can't.
Yeah, I know because of my rambling. And I also want to point out, so do we have written testimony from the people from the council that testified?
Did they submit anything?
Did they submit written testimony?
I'm gonna look.
Some people did.
Then Josiah and Miles would be the two people.
Perhaps we should review their testimony. I mean, they are members of this council, correct?
They're the like people who run it.
I have the list up somewhere here, if it's helpful to you to see who is on council. Helpful, at least what's posted online. All right, it is.
Are you looking up those two guys?
I'm looking to see if there's anything on the record.
I was just looking for Josiah, but I didn't find anything.
Okay.
So here's what I find on the ADS
That's-
website for the members of the council. So the co-chairs are Susanna Davis and Josiah Raish. And then you can see the representatives appointed by each of the executive appointing authorities.
And Josiah is the one who testified.
Josiah testified and
We asked him for written testimony, but it's not in
He
here.
said he would give it to
do
us.
we need to, okay, so should we go back and we should all independently watch his testimony again? To see what, I just feel like I think that we should defer to the council members currently on what their needs indicate. Am I wrong in that?
They may not know. I mean, this is all.
They're on it.
He said
You know,
he,
In terms of the medical stuff.
he said they needed this expertise added to the council. I mean, he said that. He said his only concern was bumping the governor's appointee off because that guy's Philip Sussman. He's bringing a unique expertise as a person who works in cybersecurity.
Yeah.
And that's why I was saying maybe we make a small change and make a space for him, but the governor could have someone else appoint him in their place. So like, we don't have to even do that. If he's that important, they can figure out a space for him through these other appointees. But I wanted to honor that, like that he was saying like, it would be sad for him to go, you know, but they did say they wanted those 3 new perspectives. So.
Who's the other gentleman with Josiah?
Miles.
Miles? Let me see if he did.
I don't see anything in writing from them though.
No, nothing.
Do we have to have an odd number?
I don't know.
It's advisory.
And what was the? And I know because Alan had some issues. Can you tell me again, the state treasurer? Is that's added?
Yes, that would be.
And what was the reason for state treasurer?
They're looking at the use of artificial intelligence in public finance, not only related to healthcare, but in general. And because the treasurer manages the treasury, and that there's in other jurisdictions at a state level, they're using AI to improve state budgets and school budgets and healthcare system budgets, that his office might have, you know, a unique perspective. That's like that their office, that office of and the fact that if you look at all the different pieces of government, you didn't have the treasurer there. So we have the attorney general looking at issues. We have the judicial branch. We don't have like the management of money piece there so clearly. And that's why I added them originally. And we heard from the treasurer's office, they'd be happy to have a person on. But they spoke for like 5 minutes. So.
But we have these people, like your Attorney General Destiny or State Treasurer Destiny, but we're eliminating nursing, long-term, term care, and by-state. That's healthcare.
They're not being eliminated, they're just not on.
No, they're not on there, so
They're not being
I think
explicitly included.
I'm old school backwards. I'd want those people there, and if I needed information, that's when I'd go to the state treasurer and attorneys general and the rest of them.
Can we remember that this council exists for lots and lots and lots of reasons, not just because we have section 4 in here asking them to also look at some of this other stuff? Does that come?
I understand that.
I mean, if we were creating a whole brand new commission that just dealt with healthcare and AI and things like that, then we would have lots of this in here, but it's an existing advisory council. We're just asking them to look at some more things and that maybe they should have some representation.
Looking at more things, we're thinking of healthcare, right?
We're asking them to look at something healthcare, but you know, there could be 12 other committees in this body right now who are like, oh, let's have them look at this.
Right, I would also note that section 4 of the bill has them looking not just at healthcare and human services, but also education, public participation, and public finance.
Yeah.
That's perhaps some of the rationale for having other people.
Karen, did you have a question?
I had two.
Yes.
On the governor's appointee here, it seems the critical role is the expertise in cybersecurity and that kind of technical aspect. I mean, that's what they value. Is it possible just to make that appointee by the governor have that expertise as part of the categorically? So it's just an open question.
I thought the governor's appointee that we replaced was in the field of ethics and human rights.
Yes, we gave that back to the social workers, but I think what I'm hearing you say is, can't we give the governor a seat still for cybersecurity?
Yeah.
And that's what I was suggesting earlier, is giving like I was saying, maybe we say the governor has a member at large, and then the governor at whatever moment in history can decide what's missing, and they get to pick and add a person to the mix that they decide is relevant.
Yeah.
If you know,
Because we're not
yeah,
eliminating a position for cybersecurity. It just so happens that the person that is currently serving in that role would.
Right, I think the position is specifically in ethics and human rights. So the fact that the person in that position also has cybersecurity expertise may be a benefit of that particular individual.
because that's what I heard from the witness, and I was like, how is this person an expert in human rights and ethics? He didn't really articulate that. He just said they're bringing something. I took it, my processing of it was cybersecurity is ethics on some level, but I think having a social worker's perspective is so important, especially in the intersection of education and healthcare, working across all those settings, that I think we should have the social worker be the ethics person. But I like the idea of giving whoever the governor is at any moment in history a seat that they can choose what they think is relevant at that time. And so Phil Scott can put right now who he thinks is best. And if he thinks it's Phil Sussman, right? Good, put him, because my intent wasn't to remove a member. It was to try to find a creative way to fit healthcare providers and educators to the existing structure without adding a lot of members. I was trying to minimize,
So my second question, and I'm just thinking, is when I look at that list, when I think of the purpose of this section, how do you do with healthcare? It does seem like the healthcare piece is lean. It does seem really important to have those positions on there.
So would anybody be opposed to exactly what's in the bill right now and then adding O? Does M-O come after N?
LMNOP.
And-
N, don't forget N.
Yeah.
Adding N to member at large appointed by the governor.
From healthcare.
No, I think it would just be a member at large.
So can I ask you a question? Well, just because you have, right now, the appointee of the governor is the member with experience in the field of ethics and human rights. Now you're changing that to the National Association of Social Workers. I don't know if they specifically have the connection to the fields of ethics and human rights different from other areas. So I know there've been talk about putting a social worker appointed by the National Association of Social Workers. Would you want to keep the governor's appointee in the field of ethics and human rights and add a social worker appointed by the National Association of Social?
I would prefer to let the social worker have the human rights and ethics, because that was in the original task force, how it was, and giving the governor more latitude, saying, Governor, we trust you. Pick whoever you think is best in this moment in history, whoever you are. Democrat, Republican, progressive, whoever you are.
Josiah had recommended, we appoint someone from the American Psychological Association.
I didn't hear.
American Psychological Association. I think that was one of the ones.
That was one of the suggestions.
Topper has a question.
I guess it's a question, a statement. I keep hearing the governor, the governor, the governor, the governor. Why don't we just talk about what the intent is? If we want the governor to have an appointee, that appointee has to follow what's outlined in here in terms of the expertise that they have to contribute to this committee. Period. Don't worry about governor on the appointments. Just worry about getting somebody that has the expertise to do it. That's how I feel about it. I don't look at it as it has to be or it doesn't have to be the governor's appointment.
Wendy.
Oh, sorry. I'm gonna veto the whole ethics thing getting removed from it. Because I think this is a brand new field and ethics, these people study years on this thing. We've had to call, my previous job, had to call people from ethics in to go over everything that we had done and what this. I just think that's too important to leave off this.
More important to what? Wendy?
To leave off this list.
Are we
That
leaving?
Phil Sussman, who is the ethics, what is his actual title?
He's appointed by the governor as a member with experience in ethics and human rights, but we're not removing
We're not removing.
ethics. We're just letting the social workers appoint someone
It, as a,
in the field of ethics and human rights.
Not to muddy the waters a little bit, but this is more of a question for Brian. Why would social workers have any more qualifications around human rights, ethics and human rights than, say, the Psychological Association, the medical ethicists? Why is it social workers? That's my question.
Probably because in the original AI bill, it was written by a social worker.
Oh,
And then
I didn't go there.
And then, yeah, but then there was extensive testimony. And it was vetted through the legislative process and passed unanimously and signed by the governor. So everyone agreed that a social worker, after all that testimony, made sense. And then when the second bill passed, the Senate changed the membership of the task force to be all these state agency people. Like, they completely changed what the House did and made it into this group that's mostly appointees of the governor. I know you don't want to keep hearing that, but it's like all these people who are like heads of departments, and you didn't have the community voice. And now we're in a position where they're not equipped to weigh in on important things at a pivotal moment in history. And so I felt adding a social worker and a doctor and a teacher, an educator, was one way to bring those voices in, you know? So I think social workers are uniquely equipped in the field of ethics and human rights, because if you look at we have a code of ethics. Our training is it's grounded in principles. Lynn from the NASW actually testified about this. So that's why I think it should be a social worker. Now, one could say, like, no one told me how the governor's appointee in ethics or human rights is an expert in human rights or ethics. So, like, we're assuming that person has that. No one's explained it yet. But what I did hear is he's valuable, and I didn't want to remove a person. So that's why I was saying, let's make a seat for the governor to keep whoever he wants on, so we don't take an asset away from the committee.
I would like to move away from the conversation around the governor's pick and like take that out. I'm just trying to get at, okay, who really should be naming somebody who actually does have an expertise in ethics and, I'm sorry, what was the other?
Human rights.
Human rights, thank you. Leslie?
Well, I think that I'm sort of thinking about it in a similar way, but thinking about it in terms of like arenas, for want of a better term. The ethics and human rights arena, the clinical medicine arena, the psychological mental health arena, so that we have people representing each of those bodies of constituents, for want of a better term, so that they would be represented on there in addition to who we have. So that's how I would think about it. So I'm saying what you're saying, in that there's a clinical person, I'm sorry, Dr. But that's my bias, got it. But then there is someone who's doing clinical medicine in the room. There's someone who is doing, mental health medicine in the room. There's, so, and the educator, I agree with that too. So I'm thinking of it as arenas now.
And I will just say that I am not interested in changing the direction of this advisory council to be majority healthcare. So, I mean, I'm not interested in doing that. If somebody else wants to submit a bill to put in to create a healthcare AI advisory, then they can do that. But I'm not interested in doing that today. I'm not interested in taking an existing council and changing it to sway it all towards one particular area. I think that it needs some additional voices, but I'm not changing the direction of it. I'm sorry, go ahead.
It's okay. I didn't want to interrupt you, and so I wrote it down so I wouldn't forget. So one, now I'm like, what does this scribble mean? Oh, one is just to your point. If this group comes back in a year, they can say, we need a healthcare advisory. They can come back and ask for that.
Mhm.
Like, they have a year to come back and ask for that. So, they will, if it's in the current language there, it gives them the scope to come back and suggest, let's change it. So they can come back and ask for that. Two, I wanted to say more about why I think a social worker is important, because I feel like I didn't do it justice. That in social work, when you receive social work training, you receive 5 levels of training. There's individual, family, group, organizational, and community. And you have to learn how to practice in school on all those levels. And then wherever you're working in a system, you're thinking about all those levels. And so social workers get training in clinical practice and in direct practice, but we also get training in policy. and we get training in theory, and we get training in research. And then, the core of social work is this commitment to human rights and to ethical practice. And so the reason I think when I say I'm biased, I'm being honest as a social worker that I'm biased, but it's not like I'm just biased for no reason. It's because I have training as a social worker and I understand what we do. And if you have like a clinical provider, like the doctor, the medical society, and you have an educator, the social worker is bridging schools, hospitals, clinics. They're working in every possible setting you can think of, providing direct service, but they're also administrators. Social workers are also running programs. They're providing supervision. They're creating policy. And so giving the position to a social worker brings a perspective that it can bridge the healthcare and education sectors and bring the human rights and ethical perspective all in one person. And that's why I thought it was important to put social work back. But I am biased because I'm a social worker. So I'll admit that. I think most people won't admit they're biased. I think it's important. But I'm biased for a good reason.
Can we, because we have very limited time, can we sort of table the discussion around who's on this? And can we talk about the rest of the bill? I'm trying to get a sense from the committee. Number one, I'm trying to get a sense from the committee whether or not you even want to move forward with this bill. I'm trying to get a sense of what you think about the changes, the subtraction of essentially 20 some pages. Whether or not you're in alignment with just changing some members and also what some things that we'd like them to look at. That's what I'm interested in right now. So we have this warned for a possible vote, and I'm thinking there's not going to be any vote today. So just Leslie and then Topper.
So I'm prepared to vote on this bill. I think I think what I got reassured by is section 4, which is the report. And the report is really clear on what it says. Review guidelines, recommendations to AMA, that includes clinical medicine, social workers, and education. So that's all included in the report. So the advisory council is going to have to look at all those things in order to create their report. Other relevant professional organizations, including healthcare, human services, education, public participation, and public finance. That includes the treasurer. That's cool. 2 is the research, existing potential uses, et cetera. Create opportunities. I think that's great. I think we could add a 4, which says review the composition of the advisory council and make recommendations. And then I would be happy to go.
Thank you.
I think that we should stay with the intent, which is to the responsible use of artificial intelligence technology, and then the report to the director or whatever she or he is called, of the division of artificial intelligence. I think we should stick with those 2, because what I'm feeling is adding all the other people, not that they don't have information maybe that the director of artificial intelligence can use as they develop ways they're going to use artificial intelligence in state government. I just don't think adding a lot of people in this legislation.
Do you mean are you okay with adding the 3 people, or are you saying make no changes? I'm confused.
I'm saying that we already have a council that's set up to provide this assistance and recommendations to the director of artificial intelligence as they develop the use of artificial intelligence in state government. That's what I'm saying. Now, if there are other people with the expertise in artificial intelligence and the expertise in areas, it isn't just healthcare. It's what we're going to do with artificial intelligence in state government. Now, before I go any further, am I wrong in that assumption?
That it's about what happens in state government.
It's about what the Office of Artificial Intelligence is going to do going forward.
Yes, and also engaging in public outreach and education on artificial intelligence.
Yeah,
Part of its
yeah.
current mission.
Okay. So I think what I'm feeling we did is we zeroed in and just said the application of artificial intelligence in healthcare. Am I right in that assumption?
Well, the positions that are being added and some of the additional language, I think, is around healthcare, human services, education, and public finance.
But doesn't it all relate?
It all comes, but yes, it all comes back to, at least in the existing law that is unchanged in the bill, it all comes back to providing advice and counsel to the director
Yeah.
of Division of Artificial Intelligence with regard to the division's responsibilities to review all aspects of artificial intelligence systems developed, employed, or procured in state government,
That's,
and engage in public outreach and education on AI.
okay, so at this point in time, we as a committee, are we talking about, we just want to limit our input to healthcare?
No.
I didn't think we were, but I'm just asking these questions.
What we're doing is in the first section, we're actually putting in some intent and definitions. And,
Definitions.
well, okay, or a intent and sort of a
Rights.
Of rights.
Code of rights.
a code of rights. Section 3, we're taking an existing advisory council. And I'm sorry, did we hear from the director of the Division of Artificial Intelligence?
Yes, that's Miles.
That's
Yeah,
Miles.
some,
Was Miles in favor of this
yeah.
change? Okay, so the very person in state government that this advisory council is reporting to, that person said, A-okay?
They said, so I don't like speaking for
And
people,
that
but they
they could
said
use.
they needed some extra voices at this moment and some guidance, some direction.
Yes.
Dealing with the use of artificial intelligence.
Specifically in the health and education sectors, because those are the areas where we're gonna see some pretty major advancements. So what the bill does is, it's us saying like, we're guaranteeing some rights. We're adding some people to an existing council and giving them a mission for the next year to come back to us with some ideas of how to protect these rights. And they were okay with that. Where this is getting complicated, everyone wants to be involved.
Yeah.
And now we're getting really caught up in that. But in the end, I think I would settle for just adding the 3 people in the seat for the governor and then letting them come back to us and tell us what other changes are needed in the future. And the other change I would suggest is this go into effect on passage, because we heard that the sooner they get started, the better. But if we agree to like leave the membership as it is, add a seat for the governor and make it in effect on passage, I would be comfortable voting on it today. I feel bad leaving people out, but the reality is we're taking all this time and where are we getting with that? So.
Yeah.
So I hear you on that.
I am generally in favor of leaving the bill as is in this current version and maybe adding back in just a governor's designee.
You want to say
At
something
large.
general, like one member with relevant knowledge and expertise appointed by the governor or something that,
Because the rest of it,
Medicine or just?
No.
that wasn't what I was hearing, yeah.
if you look
So
at,
that, so
Because
that
one
can,
of the governor's picks got taken away and they weren't thrilled with them being taken away. So just give the governor back
Yes.
an at-large.
Yeah.
And they can appoint whoever they wish, including the apparently stellar
Yeah.
person that's in the position.
It's
Um,
very dynamic, so that's flexibility.
yeah,
Okay,
So didn't we add F, G, H?
so we're just adding in either, are we just
I
adding
agree.
in?
we will add N,
We'll add
let
N.
him close it out.
Okay.
we better stop before we get to Z.
Is there anyone who is opposed to that?
Okay. I,
What's that?
that,
Yeah.
Adding-
Basically taking what's there on the page now and then adding back in an at-large member that has the governor. Because the people that,
Leaving the rest of it as is.
Yeah, so I've got it up on the screen, so we would just simply add a new, would move the and it would say N, one member with relevant knowledge and expertise appointed by the governor.
Okay, so we're changing
You're adding.
where they come from.
Yeah.
We're changing 10 of them. Where they come from, are we not?
no,
So you're changing a couple, you're changing two, and you're adding four. You're sort of changing the governor. The governor one is sort of a,
Changing to.
we're taking,
And you're not-
taking away one of the governor's picks in the field of ethics and human rights, and we're changing it that somebody else
social
picks it. And then we're giving back the governor his pick,
Right.
that he can pick anybody with expertise.
It doesn't just have to be
And
human rights
then
anymore.
we're changing also another member.
the commissioner of health.
Yeah.
I mean, effectively, the commissioner of health, you know, we could frame these differently. The commissioner of health or designee sort of becomes the secretary of human services or designee, and you're adding a member with experience in public education appointed by Vermont NEA. So if it's easier for people to see it that way, I can reframe it that way.
I like the idea of it being commissioner of health because it says health, whereas AHS is such a broad.
But AHS is the commissioner of health.
It is, and there's also, we have to think more
Well, not necessarily.
holistically.
That's what I'm struggling with, not necessarily.
But they report to the Agency of Human Services, and the reality is that we're too siloed, and so the reason I made that change is like if they think the Commissioner of Health is the best person, they'll appoint them. But
Right.
But
I will note that the current appointee from the commissioner of health or designee is not the commissioner of health. It is Amanda Jones, representative of the Department of Health.
who could still be appointed by the
Right,
Agency of
who could
Human
still be
Services?
Appointed by the.
So it's just, that was just me like restructuring it. I'm not attached. It was just me zooming out and being like, let's just make it that branch of that piece of government has the seat, not that specific person, but.
Okay,
Can you clarify one thing real
Yes.
quick? So you're taking away that Phillips Sussman, is that?
No.
You're not taking.
We're
it
creating,
away.
space for him in an at-large seat that the governor has.
I'm not comfortable with that. I have to say, I just think that it's mandatory for someone with an ethics background to be on.
It will be.
It is a
It's
seat.
appointed by the National Association of Social
So the
Workers.
governor.
Doesn't necessarily say that they have to be an expert in ethics.
Yes.
do they?
yes.
Yeah,
Yeah.
that's still saying, it's just.
The one that we took
It's the
away
same
from the
language.
governor.
Yes.
Had to be in ethics and human rights. We are not taking away that there's somebody in ethics and human rights. We're just changing who is appointing that person. And then we're taking the governor's pick, who he got to pick in ethics and human rights, and we're giving him a new pick to pick anybody and anything that he wants.
It can still be someone with it.
It can be
Ethics,
somebody.
Human rights.
Which means we might get two
So we're
people
not
with
losing.
ethics experience now. Because the social workers will have them.
So we're not losing anybody
Okay,
in ethics and human rights.
okay.
And I've been thinking quietly, but I mean, lawyers are always trained in ethics too, so even though, so
That's right.
John Dooley is very strong.
He is.
I honestly believe that everybody here, regardless of your profession, has been trained in ethics. Whatever your
Yeah.
profession is. This is just so new, and I think it is just so important to have somebody that's front and center, that's of ethics. It's a scary, we're in a new territory here, and it's scary, and I think it would just be reassuring to know that somebody.
Well, I think it was so important that when they created this, they did that. And it's still there.
Okay.
And easy.
But and I think Val brought this up and it's an important point, one member with experience in the field, not expertise.
I'm fine with that. Yeah.
Okay. Is everybody fine with what we'd like them to look at, the project that we've given them?
And that's where I wanted to ask, did you want a reference to, so in coordination with the Director of Artificial Intelligence, do you want this to be and in consultation with interested stakeholders?
Yes. So all the people that want to be on it are now interested stakeholders.
So they can be involved without worrying about the stipend and without,
And a quorum and sorts of other
and
things.
who knows what the Senate will do if this goes over there, because they changed the last thing.
Hopper, you have a question? Do you have a comment?
I just feel that everything that is underlined here is a change. My,
Section 4?
yeah,
Section 4 is brand new. Section 4 is just a one-time study and report. It's not changing the,
this is the membership.
right, so the membership, everything that's underlined is new.
It's new.
But some of
That's
it is
what I thought.
not adding members, it's just changing members, changing the appointing authority or.
Okay, let me, maybe one question.
Sure.
Where it was Commissioner of Health,
Yes,
now it says the person who is going to be selected is going to have experience in public education appointed by the Vermont National Education Association.
yes.
What has that got to do with health?
It doesn't have anything to do with health. This is the group this is the Artificial Intelligence Advisory Council.
Yeah,
who
okay.
Is now
So
getting
we
a
get-
broader scope to look at healthcare, human services, education, public participation, and public finance, at least in the shorter term. So looking at, I think the idea, if I can speak for the sponsor of the bill, was that artificial intelligence is being used in so many different sectors now that having people with not just healthcare, but also education background is going to be important for advising the director of
Okay.
the Division of Artificial
we-
Intelligence.
We've said we need health, okay? Does the Secretary of Human Services fill that bill? Is that,
So you have a couple of people in the health area because you have one member with experience in healthcare appointed by the Vermont Medical Society, and you have the secretary, basically you have Secretary of Human Services instead of Commissioner of Health.
They needed somebody with education.
And I'll swap it so that it's clear that Commissioner of Health becomes Secretary of Human Services, because I think I created confusion there.
and all of these people don't have to have experience, at least as far as I can see from the way it's written, in artificial intelligence.
Not specifically, I mean, they're providing advice.
Let's give them
Right, you want the director of the Division of Artificial Intelligence to have experience and expertise in artificial intelligence, and the others may have some, but are also advising.
Good, Jen.
Okay.
Okay.
Thank you. All right, I say we move to the Office of the Attorney General. Just walked in.
Good timing.
Well, he's already on there, right?
Yeah.
You are,
He was
you
on
are
time. We already.
so disappointed that you didn't miss the last hour and a half or so.
I'll just walk in tonight.
Thank you for making time for us in your busy schedule.
Thanks so much.
Yeah, and thank you.
Thank you.
Thank you. Good afternoon. Todd Delos, Assistant Attorney General. Good to be back and thank you for inviting me. So I will just be totally honest with you all. I had not looked at the latest draft of H 814 until later this morning.
That would be before any of us
Ah,
looked at it.
Okay,
either,
as
so-
long as we're all in good company. I'm happy to talk a little bit broadly about the former version, and I don't know, I'm happy to answer questions about the current state of it. Because I don't believe we're really implicated, the AGO is really implicated in the current study. I know we are on the AI Advisory Council and play a role there. So you tell me where you want me to go, and I'm happy to go.
As from having an appointee on the advisory council, I think the question would, in your experience, would there be, do you see a problem with some of the other people that we have now added and changed? And spoiler alert, so you don't have to watch it tonight, there's going to be an O. N. I keep leaving out N. I don't know why. There's gonna be an N, which will be sort of an at-large appointed by the governor with expertise in that. So the governor is not losing one of their picks. I'm wondering if you wanted to comment on the members that we've added, changed.
I think it's good to have an at-large. So I have attended a few of these meetings. I am not the designee on this particular council. And we see a lot of value in our role from a consumer protection angle. So I know I don't necessarily advocate for us to remain, but we just appreciate having that role. And I think there's definitely value in the work that this council does. In looking at it and understanding sort of where the bill was headed in its introduction form, certainly social workers and other mental health professionals, there's good logic to that. As we see a greater use of ed tech and AI, I think it makes sense to have educational members on. And, you know, VMS is a great part. The Medical Society is also a great partner. You know, there's nothing that jumps out at me as being deeply concerning. I'll leave it at that. I think those are positive changes. And again, I think the council is doing valuable work.
All right. Any questions? Go ahead.
So you said you've attended some of the meetings. You may not be the actual designee. And based on your observations of the current council and the work they do, and they combined with your understanding of the national landscape, where consumer protection intersects with the healthcare sector, like, do you think that the mission we're giving the group at this moment in terms of like this report makes sense? If you notice that we rolled a lot of these policy changes into the report. So we were going to make all these policy changes that other states had done, but instead we're asking the group to weigh in on them first. So I just wonder if you have any thoughts about that, the scope of that work, if there's anything missing, if you think it's too much.
It's a great question. So I was familiar with the work of the AI Council through their report. I think last year was their sort of 4 different questions that they were answering for the legislature, including sort of the scope of their own authority. And I think my initial take on the AI Council was it was really focused on internal to state government. And this is definitely a shift. And I think with that lens, understanding kind of, I think you're going to have technical expertise from in-house technical expertise. And I think that's probably going to be the most important thing. It's funny because so they have basically a year to provide the written report. One thought I would have, I think time is of the essence in this space where things are rapidly moving and adding a lot of new members. I know that this group did a lot of education around these issues as a group. And it may require, you're going to be bringing new people up to speed, likely people who bring experience, knowledge, et cetera, into the space from their specific areas of expertise. And there's just going to be some amount of time that any group requires to get sort of on the same page. So that would be one thought, kind of balancing those two pieces, because to get the work actually done takes some time.
They can use AI for.
They could. So another change that we talked about making that I don't think is in the draft, but came up in our discussion, is we heard, because time is of the essence, that it should go into effect on passage versus July 1st. That could potentially give them an extra month or two to get it, get going. And I'm just wondering if you think that makes sense, because it's not like going to affect any other regulations.
Yeah, I don't have an opinion on that. I mean, it would depend on how quickly it moves anywhere, how close it gets to July 1, but
Okay.
you could imagine.
Yes, of course. Carby Legislative Council event. So because we didn't talk about the effective date, I believe I originally put a July 1st effective date as a date certain when certain restrictions around chatbots and other things would take effect. But since you're doing things that I don't believe actively affect anyone's rights or abilities under the law, an effective date on passage seems reasonable.
You don't see a concern with that, but it probably won't be that different. But if it gives them an extra meeting, though, that's a chance to orient themselves, and that would address this idea of how a group, when a group changes, and the changes happen to a group, they always have to adjust. And I hear your point on that.
Any other questions? Thank you. Thanks for coming.
Very welcome. Thank you for accommodating. Appreciate it. I'll be back.
We are going to take a break. We will be back here at, let's come back at 5:03. I have to tell you, I am introducing an amendment on a bill that is actually on page 588, which is a miscellaneous OPR bill that's in government operations, and we're gonna walk through this amendment because it pertains to our jurisdiction. And then we'll just get some quick testimony on it, but this is going to be an amendment.
Is that what we're doing when we come back?
That's what we're doing when we come back.
So do you imagine we're gonna do a vote on 814 at some point?
Yeah, but we need a new version, so we need to give Ledge Council time. Oh.
That's the vibe I was getting.
I feel like to step away from it, or at least, I mean, maybe if we have time a little bit later. Because I don't think we're gonna take an hour on 588, although we may.
I like your idea of taking a breath.
I think
and
we need
coming
a
back
breath.
to it, like at the end of the day, if it's ready.
Yes.
Because it's just good sometimes to
Yes.
step back from the
If
table
not,
and like,
we
not
can
rush,
find
you
time
know?
for it.
Yeah.
Okay, there's so much we wanna deal with this week.
Again, I apologize because I haven't been following this. Maybe Brian, does this need to go to another committee?
it may need,
I've given no other.
it may
committees
need
a
to,
heads
it
up.
may need to go to appropriations because of the stipends, but it's a small expense and they generally, those things are quick, but
I'm wondering,
yeah.
I'm wondering who created this advisory council in the first place.
It might have to go to government operations for a drive-through. It might, because it's changing a state body. It might need to do
I
that.
will.
Which means sooner better than later.
Yeah,
Yes.
which means voting it out today would be
Figure it
better.
out.
Yeah,